To the bradycardia OSCE. We have a patient here who's presented with some chest pain earlier today. We've popped on a 3-lead, and as you can see, he's in a bradycardic rhythm. So I'll go ahead and print that. And I can see that it's wide complex bradycardia. Looks like a 3rd-degree block. So the next step is to figure out how much compromise this patient has. So in talking to him before, he was quite confused and not able to follow commands. So we'll give him a GCS of about 12. I've had a feel for his radials, and he doesn't have any radials. His blood pressure has come back as unrecordable, and he's looking very pale and sweaty. So I would class him as severe compromise. Combine that with his wide complex bradycardia, and he's a candidate for pacing. So I've prepared an IV site, a large bore IV in the left ACF. I'm going to prepare some of my resusc equipment, so I've got my ventilation bag, oxygen, advanced airway kit as well. I've attached the pads, and I'm going to prepare for pacing. Now that everything's set and ready to go, we're going to begin the pacing sequence. I'm going to press the pacer button. I'm going to set the rate to 70 per minute. To set the current up by increments of 10 milliamps until I confirm capture. So we're up to 60 milliamps, and I can now confirm that there's a detection symbol above each QRS, as well as a pacing spike before each of the complexes. I'm going to confirm mechanical capture. I still don't have a carotid pulse, so I'm going to increase the rate until I do. So we're up to 100 beats per minute, and I can now confirm a carotid pulse. And I can confirm a femoral pulse. Now that we've paced this patient, I would expect his GCS to possibly increase, so I'm going to give him some low-dose ketamine and fentanyl as sedation and analgesia. If the pacing were to fail for this patient, we would move on to an adrenaline infusion, where we just put 1 mg of adrenaline into a 1 liter bag of saline and run that at a rate of about 1 to 2 drops per second. If this patient was a narrow complex bradycardia and wasn't so compromised, we could consider 0.6 milligrams of atropine. But because this patient's so compromised and because he's got a wide complex bradycardia, that suggests a ventricular rhythm, which is more likely to be responsive to the adrenaline or the pacing. And in this case, we've gone with the pacing.